for the opportunity of being able to speak with you this morning. I'm a pediatric endocrinologist and a pediatrician, board certified in both specialties. I have been practicing pediatrics for 44 years, pediatric endocrinology for 40 years. I started out in Johns Hopkins Hospital Training Center with Dr. John Money as a faculty mentor. Dr. Money's principles of let's do something to a patient and see what happens created morbidities that were found to be, in some cases, fatal in patients who were essentially physically changed or medically changed from their biologic sex. So the program at Johns Hopkins, where I trained in at that time, was closed down when it was verified that the long-term outcome of these patients, both adult and children who were essentially made to be in opposition to their biologic sex by social transition, medical transition, and surgical transition, they had horrible outcomes and ended up, the program was closed. That is an experimentation on children without any scientific basis. In the years intervening, what we have is no valid studies that show that this is recommended for transitioning is safe and effective. There are many studies that are anecdotal. The World Professional Association of Transgender Health is an organization that is a transgender advocacy group. It does not base its recommendations and its, quote, standards of care on science, because when you review that document and those recommendations critically, they fall short of showing that it is safe or effective. The Endocrine Society in the United States is a professional group that created a set of guidelines in 2009 and 2017. They were revised again, and those authors of those recommendations and guidelines clearly state that there is no valid scientific evidence for what they recommend, and that their recommendations are based on their personal, strongly held beliefs. It is those organizations and those recommendations that caused the American Academy of Pediatrics to approve guidelines that were published in September of 2018. After that publication, a very prominent LGBT activist, psychologist, tore those recommendations apart as invalid based on the fact that the recommendations were based not on actual science, but on opinion or misrepresentation of the data. Sex is biologic. There is absolutely no proven, reproducible evidence that gender is biologic. Gender is a concept in the head, biology and sex is in the body. And when they're incongruent and we're going to do things to block puberty, there is no study that shows blocking puberty in a pubertal age child is safe. What the experiment is in all the 55 transgender clinics across this country and those in this state, those patients are being subjected to an open-ended, uncontrolled experiment to block puberty, and see some 20 or 30 or 40 years later. Thank you.
Thank you. Thank you.